Okay, so for today we will be starting a new lesson. Okay, and this is about informed consent. So informed consent is a very important uh, doctrine or principle that is involved in our practice. In the previous lessons, na-discover natin that having informed consent ay product ng Nuremberg Code. Okay? So, ano ba yung informed consent? Ito ay gaano kahalaga sa practice natin at kung hindi ito nasunod, ano magiging consequences? Okay? So first, patient consent can either be verbal, written, or implied. Okay? So, basically, ang consent para siyang contract. Pwede siyang through words lang. Pwede rin siyang written. Ayun. So, as I was saying, patient consent is very important in our practice. And it is one of the concepts or doctrine or principles that we must uh, study in professional ethics so that we may be aware of what possible consequences, legal and ethical, na pwede nating kaharapin if ever na hindi tayo makapag-comply or hindi natin masunod yung pagkuha ng informed consent. So, patient consent, di ba? When we say consent, ito yung pagpayag, di ba? Yung pagbigay ng kanilang uh, cooperation ng patient when it comes to uh, undergoing any procedure or examination in the hospital. So it can either be verbal, written, or implied. So katulad ng contract, pwede siyang words only, verbal words, spoken words, pwede na siyang written and implied. Diba? Okay? So, of course, consent is different from informed consent. Kasi pag sinabi natin consent, it's parang simple lang siya na uh, parang ganito lang yung consent eh. Ay po, patient ganito, mag-undergo po kayo ng CT scan ng chest CT scan. Papayag po ba kayo o hindi? So, pag papayag yung patient, sabi niya, oh, pumapayag ako. That is simple consent. Okay? However, in medical ethics, okay, ang kinakailangan is informed consent. Yes. So what is informed consent? Okay? So it is a process of getting permission before conducting any healthcare intervention on a person. So that means lahat ng procedure or examination, ultimo paglalagay sa pasyente sa isang room, mapa-ward man yan or private room. So, kailangan ng informed consent. Then, it is given. So, informed consent is given based on clear appreciation and understanding of facts, implications, and consequences of an action. So, yung action dito yung tinutukoy yung mga medical intervention or procedures. Okay? And basically, informed consent is a right, okay, of every human being of adult years and sound mind. Okay? It is a patient right. So kung makikita nyo, nakanilagay dyan na yung adult years and sound mind. So bakit siya nakalagay? Because uh, they are two of the criteria needed in order for an informed consent given by the patient to be valid. Okay? So hindi lahat ng pasyente pwedeng magbigay ng informed consent. Okay? So bakit natin kailangan malaman ito? Dahil sometimes it can be very technical and pwede, pwede kasing alam mo na, laging mapag-uusapan natin dito is lawsuits, either civil, criminal, or administrative. Okay, when we say civil, so alam mo na, danyos, di ba, damages. So merong magbabayad ng damages. For criminal, kulong. For administrative, that means cancellation or revocation of licenses. Okay? So we have different levels of informed consent. Simple consent. Okay? So, it is a matter of obtaining the patient's permission to perform a procedure without knowledge of the procedure. Katulad to yung example natin kanina na basta mo lang sinabi na mag-undergo ka po ng chest CT scan. So, kailangan lang po ng consent nyo, pwede po pumirma kayo dito. So, yun lang. Okay? So, wala siyang any information or the RADTech doesn't give the patient any information regarding the procedure. Okay? Hindi man lang in-explain ng healthcare professional kung ano ba yung procedure na gagawin sa pasyente. Na let's say, ito po ay CT scan, so gumagamit po ng radiation para makapag-produce ng image, etc. Or, yun nga, later makikita natin ano ba yung mga kailangan na facts na kailangan malaman ng isang pasyente, okay, when we are giving informed consent or when we are asking informed consent from the patient. So simple consent yan. Okay. Simple consent is further divided into express consent. Okay. So express consent, this occurs when the patient does not stop the procedure from taking place. Okay. Let's say, hindi mo na tinanong yung pasyente kasi pumunta naman siya sa department, lumapit ang pasyente, magpapa-CT scan po ako, binigay yung request, pagkabigay ng request, tinawag mo na siya, o dito po, sumunod lang po kayo sa akin, gagawin na po natin yung procedure, then natapos yung procedure. So that means consent is given already. However, it is just simple consent and further it is unexpressed consent because the patient did not stop the procedure So the mere fact that the patient did not stop the procedure means that the patient consents to the performance of the procedure. Okay? So yun yung express consent. So walang words, walang conversation na nangyari between the lab tech and the patient. Okay? Walang written, walang pinirmahan ng pasyente, express consent lang. So that is considered as consent already. Then the other one is implied consent. Okay. So implied consent, so if I remember correctly, nabanggit ko na to before. So it is given in emergency situations only. Okay? So nangyayari ang implied consent kapag ang mga pasyente ay walang kakayahan magbigay ng consent. Okay? So either the patient is unconscious, okay, or lacking of the requirements or conditions for uh, giving informed consent. Okay? So, uh, yun. Ang pwedeng magbigay ng implied consent, okay, ay doctor only. Doctor. So, let's say, example, merong pasyente na vehicular accident, VA. Okay? So, normally, pag ganun, VA, ang mga pasyente is either unconscious. Kung hindi man unconscious, they are, ano tawag doon? Hindi sila aware sa mga nangyayari sa paligid. Okay, so yung kanilang reasoning is impaired. Okay? And then, lalo na kung ang isang vehicular accident, ang nagdala ay emergency response team. So that means walang uh, relatives present. Okay? So kailangan ng uh, immediate action. Let's say, kailangan yung pasyente ay maoperahan agad for surgery. So the attending physician or yung ER doctor, hindi niya nahihintay na dumating pa yung uh, yung relative ng pasyente para makapag or matuloy yung surgery, which is urgent na, na mangyari. So the doctor will exercise yung implied consent. Okay? So basically, pag sinabing implied consent, so yung ipagpapalagay ng healthcare provider, healthcare professional, which is the doctor, that the patient will give permission, will give consent kung sakali man na siya ay conscious doon sa gagawing uh, procedure doon sa patient. Kaya siya ay implied. Okay, again, pag sinabi implied consent, ito yung pagpapalagay ng mga healthcare professional na ang pasyente ay papayag na gawin yung procedure. Kung sakali man na yung pasyente ay conscious sa panahon yon. Subalit, hindi nga conscious yung pasyente, unconscious, so ang magde-decide para sa kanya is the attending physician. And that is the meaning of implied consent. So they are type of simple consent. Simple consent dahil walang nangyaring information, di ba? Walang binigay na information ng healthcare provider sa pasyente. Next is inadequate consent. Okay. So this is also known as ignorant consent. So from the term inadequate, so may kakulangan. Okay? So nangyayari ito kapag ang pasyente ay hindi nabigyan ng sapat na kaalaman para makapagbigay siya ng informed consent. So the patient can bring charges of negligence, okay, when they had inadequate consent. So negligence. So again, ang negligence ba anong pwedeng mangyari sa isang healthcare professional? What kind of charges ang pwedeng ikaso sa or anong klaseng cases ang pwedeng i-file? Negligence. Criminal ba? Civil, administrative. Okay, ang negligence ba ay criminal, civil, or administrative? Criminal. Okay? How about the others? Civil. Oh, may isang criminal, may isang civil. At may yata pa, parehas, di ba? Parang hindi sure. Samantala na-discuss naman last time. Very clear. Binanggit pa natin, meron pa tayong binanggit na revised penal code at civil code of the Philippines. So negligence is both criminal and civil. As well as, syempre, dahil sa the healthcare professional ay license, so administrative case also. The administrative case will be filed saan? Kung ang civil and criminal cases ay sa court of law ipafile, saan naman pinafile ang administrative case? Which body governs the practice of professionals in the Philippines? Saan? Ano yun? Ay, hindi ko narinig. PRC? Philippine Red Cross? PRC ba? Anong PRC? Philippine Red Cross? PRC pero hindi Philippine Red Cross, di ba? Ano? Ano ibig sabihin ng PRC? Ayan, mali na agad. Mahilig, mahilig kayo sa Philippine, ha? Professional. Professional Regulation Commission. Okay? So, doon po magpa-file ng uh, administrative case. Okay? Yan. So, inadequate consent kapag ang patient ay nagkaroon ng injury. So, bukod sa negligence, pwede kang ma-charge ng battery. Okay? So, ano ulit pagkakaiba ng assault sa battery? What is the difference between assault and battery? Okay, so very good. So assault ay threat lang, verbal abuse, pinagbantaan ka lang, so assault. Pag battery, meron ng involvement ng ah, touch, physical touch. Okay? So not necessarily sinuntok ka, battery yon. As simple as unlawful touching, it is considered battery. Okay? So these are the conditions in order for an informed consent to become valid. So number one, of course, the patient must be of legal age. So what is the legal age in the Philippines? So, ilan na ba sa inyo ang of legal age? Lahat ba kayo of legal age na by next year? Sabi ko na hindi tayo nagkakalayo ng edad eh. Okay? So, 17. So, the next year, 17 ka pa rin. Okay, so next is, patient must be of sound mind. Meaning, hindi siya baliw, wala siyang any psychological disorder. Okay? So, yan. Of sound mind. Conscious. Okay? So, yan yung another condition. Next is the patient gives the consent freely. Hindi siya pinagbantaan. Okay? So, halimbawa, radte ka, nakalagay dun sa request, favorite mo yung request, yung procedure na gagawin. Let's say, ang procedure is lumbar spine, epilateral. Favorite mo, gusto mo nang gawin kasi isang linggo na walang lumbar spine na for x-ray na dumarating. Eh may dumating tapos parang nagdadalawang isip yung pasyente. So, in-explain mo yung procedure. In-explain mo naman. So, ganito po yung gagawin natin, ganito po, ito. Tapos, bigla mo sinabi, naku sir, kung hindi mo po ipapagawa yan, lalala po yung sakit nyo sa likod. Okay? So, sabi ng pasyente, o sige, pagawa ko na tong procedure na to. Okay. So, is the informed consent valid? Valid ba yung informed consent? Nakita mo, 32 years old na yung pasyente. Okay? Nakausap mo naman. Habang nag-i-inform ka, ini-inform mo siya ng mga information regarding the procedure, naintindihan naman niya yung sinasabi mo. Okay? Nagbigay naman siya ng consent. Ang tanong, valid ba yung informed consent na binigay ng pasyente? Valid ba? Diba? Sinabi mo lang naman na pag hindi mo po pinagawa yan, lalala yung sakit mo sa likod. So, is the consent valid? Hindi. The consent is invalid. Why? Because the patient, hindi niya binigay yung consent niya freely. Kino-urge, may coercion, may pananakot. Diba? So, kailangan siya ay freely given. Hindi siya pipilitin. Okay? So next, the patient must be adequately informed of the procedure. So kung ano man yung mga information na yun, later isa-isahin natin. Okay? So again, ito yung conditions. We have 4 conditions. Okay? So una, of legal age. Pangalawa, of sound mind. Pangatlo, consent must be freely given. Pangapat, in, in possession of adequate information of the procedure. Okay? So yan yung 4 conditions in order for the informed consent to be valid. Okay. So ngayon, ito naman yung mga information na kinakailangan malaman ng pasyente. Okay? Habang hinihingi natin yung kanilang informed consent. So number 1, pre-treatment preparation or instructions. Okay? So, habang karamihan ng mga procedures sa ating department ay walang preparations, okay? However, there are some procedures na kailangan ng preparation. Let's say barium enema and KUB-IBP. KUB-IBP means kidney, urinary bladder, kidney, ureters, and urinary bladder. IBP, intravenous pyelography. Okay? So, ang preparation sila ay pareha silang NPO. NPO. Ano NPO? What does NPO means? NPO, Sir Pau. Naku, hindi yata naturo ni Sir Pau yung NPO. What does NPO means? Hindi talaga sa midterm. Ay, very good. Okay, NPO means nil per os or non per orem. Or in English, nothing by mouth. In layman's term, fasting. Okay, so wala ang intake ng patient ng food. 8 hours NPO. So nothing by mouth for 8 hours including water. Okay? So yun yung preparation. Ang isang unique preparation sa KUB-IBP is pagising sa umaga, the patient should not kinakailangan wag muna magdadaldal yung pasyente. Hindi mo na siya pwede makipag-usap sa morning. So the rationale behind that is to prevent bubbles na mag-appear sa para hindi matakpan ng bubbles yung kanyang intestines. So yun. So may mga preparation. Sa CT scan, may mga preparation din kapag ang procedure ay with contrast. So ano yung procedure? Depende. Kailangan isang preparation, halimbawa for CT scan with contrast, kailangan mag-undergo muna ang pasyente ng creatinine. So kailangan magpakuha muna siya ng creatinine level, blood, para makita kung kakayanin ba ng kidneys ng pasyente yung toxicity ng contrast media. So yeah, so there are uh, instructions or pre-treatment preparations. Siyempre, kung merong pre-treatment, merong post-treatment or discharge instructions. So karamihan ang mga contrast studies na pinaperform sa ating department, ang discharge instruction ay to observe if there will be an adverse reaction to the contrast media. So kapag may mga na-notice ang pasyente na let's say DOB, anong DOB? Difficulty of breathing. Okay, so kung may DOB man, may appearance of rashes, so yun. So yun yung mga kailangan tingnan ng isang pasyente na nag-undergo ng contrast media study. Okay, so yun yung mga instructions. Okay, syempre, fee information. Magkano po ba ang procedure? Diba? Pwede mo bang sabihin na sa pasyente na pag tinanong ka ng pasyente, magkano po ba ang whole abdomen ultrasound? Sa ngayon po ma'am, secret, pagbalik nyo na lang po, pagpapagawa nyo na. Diba? Hindi pwede. Kailangan sabihin mo kung magkano. Okay? Benefits and risks. So kailangan alam ng pasyente kung ano yung benefits and risk na pwede niyang makuha kapag nag-undergo siya ng procedure. So in addition to the benefits and risks, may alternate ba sa procedure? Example, ang procedure niya na binigay ng doktor ay let's say CT scan, abdominal CT scan. So the reason why the doctor suggested the abdominal CT scan kasi sa kanyang abdominal x-ray may nakita na stones, kidney stones. Okay? So, as a rad tech, it is your responsibility to tell your patient na may alternative procedure for CT scan. Diba? Siyempre, sasabihin mo yung benefits and risk. Ano ba yung possible risk ng CT scan? Okay? So, siyempre, number one is exposure to ionizing radiation. So, may alternative ba? Meron. May procedure na pwedeng same effect or same result na gusto ng doktor. Okay? However, kailangan isasuggest mo lang siya sa pasyente and yung pasyente pwede niyang sabihin doon sa kanyang attending physician na, Doc, pwede po bang itong alternative procedure na lang instead of CT scan? So ano bang alternative procedure na sinasabi ko? It is ultrasound. Ultrasound of the kidneys and urinary bladder. So KUV ultrasound. So alternative, yes. Anong benefits? Walang use of ionizing radiation. Ano pa? Mas cost effective. Mas mura siya kaysa sa CT scan. Okay? And of course, involvement of trainees or students or interns. So yan, number one yan. I mean, very important na dapat alam ng pasyente na mayroong trainee or interns involved in the procedure. And of course, the role of the person performing each stage in the examination. So, kapag contrast study, yan, may mga iba't ibang uh, part ng procedure. Yung pag-inject ng contrast or yung initial injection ng contrast, let's say, bolus, okay? Yung bolus, usually, ang nag-inject ng bolus is uh, the radiologist, okay? Kung walang available na radiologist, is the ER doctor or depende sa protocol ng hospital. Okay? Pero doon sa mga hospital na nag-intern ako, it's the radiologist, the residents, ng residente. Okay? So they are the one who are in charge dun sa bolus. Okay? At after doon magkakaroon ng scanning, and then ikakabit na yung power injector. So sino yung magkakabit ng power injector? Rad tech ba, radiology nurse ba, intern ba, o kung sino man. Dapat alam nyo ng pasyente. Okay? So again, yan yung mga different informations that the patient needs to know. Okay, before granting informed consent. Okay? Pre-treatment preparations or instruction, post-treatment and discharge instructions, fee information, benefits and risks, and alternative procedures kung meron, involvement of students or trainees, and the role of persons performing each stage in the examination. Okay? Malinaw po ba? May question? May question? Okay. So valid informed consent can be obtained from the following if patient cannot give consent. So, ito na yung mga substitute. Substitute sa patient na hindi pwedeng or walang kakayahan na makapagbigay ng valid informed consent. Okay? So, authorized substitute, ito yung yan. Oops. Spouse, closest of kin, parents or legal guardian of a child or conservators of mentally ill. Okay. So again, when we say legal guardian, these are people designated by the court to become guardians. Okay, hindi lang ang legal guardian ng child. So, ang isa pong adult ay pwede rin magkaroon ng legal guardian. Okay? So, anong mga klaseng adult yung may possibility na magkaroon ng legal guardian? So, first, mga senior citizens na wala nang kakayahan to decide for themselves. Yung may mga dementia. Okay? Sa mga, yun nga, mga insane people. Okay? Okay? So yan yung mga authorized. Or meron tayo tinatawag na mga surrogates. Okay? So yung surrogates, there are people that are delegated by the patient even before the patient becomes unconscious. So ito yung mga merong special power of attorney to decide on the um, medical uh, treatments of the patient, mga surrogates. Okay, so that ends our discussion for today. So informed consent.